Hi everyone, good day to everyone. I'm Saranya. Today I will present about the health condition related to nervous system, focusing on absence seizure. Okay, so my topic is the neurological disorder affect the brain and nerve system. This condition can cause problems with the movements and consciousness and behavior. In these presentations, I will discuss my case studies about absence seizure. So let's go about my case study. Instructions. My case study is about 24-year-old male patient diagnosed with absence seizures. So the symptoms they experienced first, temporary loss of consciousness and poor attentions, anxiety, memory disturbance. These symptoms affect the patient daily life and considerations. The diagnosis of absence seizures is that to confirm the diagnosis, doctors and several tests. First is the electroencephalogram, also known as EEG, MRI, brain scan, and blood test, neurological examinations. These tests help confirm the patient's absence seizure disorder. So treatment of the absence seizures is that the patient was given several medications including Epival 500 mg, Topigen 50 mg, Cloncy 0.5 mg, Mtex 100 mg, Librex is 7.5 mg. The patient has a follow-up for 8 weeks and treatment continue for about 45 months. So outcome seizure treatment is that before treatment the patient experienced frequent seizure, loss of consciousness, poor concentrations. After treatment the patient feel like seizure was controlled, mental focus improved, the patient gradually recover. So these show the proper medication can effectively manage absence seizure. So that's my case study about seizure. Thank you for the attention.
So in continue, my name is Muhammad Kasim bin Abdullah. My metric number is 320412211001. So today we're going to talk about the case study of Parkinson's disease. So the patient details is 36 years old female. The condition the patient has is advanced Parkinson's disease. So patient history, the patient have a previous depression in remission. So the symptoms that the patient has is tremor, slow movement, muscle stiffness, and poor response to medication. So Parkinson's disease treatment. So the patient has get the treatment such as deep brain stimulation (DBS), electrodes implanted in the subthalamic nucleus (STN), electrical impulse regulate abdominal brain activity, functional MRI used to monitor brain response. So the outcomes of DBS treatment. So once the patient gets the DBS treatment, the patient will have the left brain stimulate, improve motor symptoms, right brain stimulation, temporary disease mode. Mood symptoms resolve after about 4 weeks. In conclusion and awareness, the patient at early diagnosis and proper treatment improve the outcome. And absence of seizure can be controlled with medication. Advanced Parkinson's disease may benefit from DBS. Public awareness help patients seek treatment earlier. So this is the reference from us. Thank you, madam.